12:04 in the afternoon here on 90.3 FM. 12:04 is our time. It's Wednesday. That means it's Joe Steckler helping seniors of Brevard today. And Joe, good afternoon to you. Some of the sounds of the season here.
Good afternoon to you, John. I'd like to welcome all the listeners on board with us today. Over the years, if I ever got a good tip, I try to pass it on to my listeners. And I've got several tips today. And Dr. Sheldon would be my guest. They're getting ready to bring him on in just a minute. But before I get Dr. Sheldon on, I just want to tell people that there's a place called Jerry's Action Auto Repair Incorporated over on Satellite Beach. But I had my ID card fell down in the tray between the passenger and the driver's seat, and you had to darn near take half the car apart to get my ID card back. But Jerry's Action took it apart for me and right away. It didn't even wait. It just did it. And it was a very minimal charge for doing it. But the big thing that Jerry asked me to pass on to you was the fact that he's got a tremendous sale on Michelin and Uniroyal tires. And when you can buy a Michelin tire for close to 50% of the price, that's a heck of a good tip. So I'd really, really like, and the phone number, if you're in a market for tires and you want to talk to somebody, give them a call over at Jerry's Action Auto and ask for Isaac, and they'll talk to you. They have the tires, they want to sell them, and when you get a Michelin at close to 50% of the price, that's not one tire, that's on all four tires. So think about it. And the phone number, if you just want to call them, it's 777-3888. That's 321-777-3888. And do yourself a favor. Think about it. The other thing that I want to talk about is the fact that Congress has made a change to the law for veterans accessing military facilities. Heretofore, the only people that could go to the commissary, go to the base, go to the gym, go to the package store, and do other things there at the base, they had to be a Purple Heart recipient, a former prisoner of war, and it was active duty personnel and military retirees, veterans with 100% service-connected disabilities. So what this law did was let the people that had a Purple Heart or they had a service-connected disability, former prisoners of war, and primary caregivers. And that's one I'm still looking into because I'm not exactly certain what that means, but by the time we do the show next week, I'll have an answer for you on that. But the point I want to make here is that we have 75,000 plus veterans here in Brevard County. And that is a lot of veterans, people. And those of you that are veterans or no veterans, I would really, really appreciate it if you'd pass this word on to the people you know that had served previously and ask them to call the VA at the Fran Jameson Drive primary VA office, and the number there is 633-2012. 633-2012. And get them a call. Tell them what your circumstance is, and see if you qualify. You could save yourself a heck of a lot of money, and you might be able to avail yourself of services that you wouldn't normally have access to. And now we've got Dr. Sheldon on the line. And morning, Lee.
Good morning, afternoon, whatever you want to call it, Joe. It's yourself.
Lee, I still feel like it's the morning. I'm trying to get all the cylinders working here, so that the legs work and the wrists work, and it's not fun having birthdays.
No kidding. So how's the brain working and the mouth working?
Yeah, well, it's nice to have a birthday when you get old enough to get your driver's license, or be old enough to vote, or be able to buy a drink or do something like that, and but as we get older, there are a heck of a lot of things we need to think about, and over the years we've done so many things, and you sent me some things you'd like to talk about on the show today, but I added a couple of things to myself I want to talk about, and I don't want you to mention anything about it until we get near the end of the show, but I want you, in your spare time when you're not talking, that won't be much, but when you're not talking, think a little bit about the effect of sugar. You didn't mention that, but I want to talk about it because so many people are talking about as we get older and we age and we start having all these inflammation problems, and the joints don't work as well. And I know so many people that have things like rheumatoid arthritis, different types of arthritis, this daggone thing they call fibromyalgia, where they don't even really know what they're talking about. And just so many things that can go wrong with the body. But I've become more tuned to the fact that the diseases in the body are not just limited to things developing in the body. There are connections that we're finding out more and more about them, with the connection between the mouth and the rest of the body, especially since I'm a cardiac patient. I'm much attuned to reading new things about the effect of mouth diseases on the rest of the body. But let's don't get ahead of the problem. But you wanted to talk about the fact today that sometimes it's just not the teeth that you have to think about there, but you have to think about the whole body problem. So what are some of those problems, Lee, that you were thinking about?
Well, do you want to talk about sugar first? Because I'm happy to go into that. We never plan a radio show. We just do a radio show. So let's talk about sugar for a second. As you get older, you're right. Things deteriorate, and you're on more and more medications. And as a result of being on more and more medications, your mouth gets drier and drier and drier. When the mouth becomes dry, it becomes acidic. It's loaded with acid.
Are you laughing, or are you just need some water?
I need a whole lot of things.
Okay.
But when the mouth is acidic, then of course the teeth start to break down. They start to become decayed. So you may have gone through your entire life never having had a cavity, but then the teeth start to decay because you're on medications, and medications are drying out your mouth, and your mouth is full of acid. Add sugar on top of that, and you've got an instant recipe to lose your teeth. So while we may have been able to get away with sugar earlier in life, we can't get away with sugar for our teeth nearly as well later in life, because the sugar and the acid work together to dissolve the teeth.
Right, but I thought I'd made you promise not to talk about sugar until near the end of the show. So, you didn't mention you haven't hit me with a new problem that you haven't talked about before. What are some of the new problems that we're talking about?
Well, one of the problems we're talking about is sinus problems. We've got patients who have sinus problems, and they feel it as a toothache. You have people with infected teeth, and those are causing sinus problems. So that's difficult to figure out. You'll go to the ear, nose, and throat, and your ear, nose, and throat person might say, "Hey, it's a sinus problem, but we can't recognize it. We can't solve it." Goes to your dentist, and the dentist has to look at the tooth and see whether, in fact, the upper tooth, which is very close to the sinus, or sometimes in the sinus, is causing the sinus problem. Now, we talked about that years ago. We haven't done a show on that in probably 5 years. But it's an interesting diagnosis because you can see people with infected sinuses and cure their problem by extracting a tooth or perhaps doing a root canal. So it's for those people who have chronic sinusitis and you haven't had a CT scan, not a CT scan of the sinus, but a CT scan of the teeth to determine if there's a infection in the tooth that's causing a sinusitis, that's something you just need to have. You just need to look at that. So that's one. And CT scans are becoming more and more popular. There are lots of dental offices now that have dental CT scans in them. You know, when I bought mine, we were one of the few, but now you'll find them in a lot of different offices.
Well, you know, one of the things you really wanted to talk about, and it's something we don't really think about, and most people don't even think about it. They blow their nose, and that's about it. When you have to blow your nose, then you blow it because if you don't, you'll drown sometime. But when you think about the sinuses, a lot of times we don't think about the problems and some of the things in a relationship between the teeth and the sinuses because when you swim in the summertime, and a lot of times if you just keep your head on one side, it seems like if you swim laps in a pool and you come out and you put your head back, then your sinuses drain back into your throat, correct?
Yep.
So is there any way to prevent that? Or what, more importantly, if that is something that happens to a lot of us, it seems to happen more in the summertime than it does the wintertime. Is that a truism or not?
Well, for me, it happens more in the wintertime than it happens in the summertime. So I don't know. I'm sure it's true for you, but it may not be true for everybody. If we're looking at sinuses, there's a particular path the fluid is supposed to take as it goes through the sinus. The sinus has a flow to it just like the bloodstream has a flow to it. And there are times when that flow is disturbed. It can be disturbed by a benign tumor. It can be disturbed by inflammation of the tissue around the sinus. It's called the sinusitis. It can be, and that inflammation can be worsened by allergies. And so the allergies can thicken up the tissue around the sinus, preventing the fluid from taking its normal path through the body. I mean, it goes up and then it goes down.
Well, let's talk for a second about as we get older and we start having more medical problems, and a lot of older people do have trouble with their teeth. They tend to fracture, crack, and break more easily. And we also seem to develop or have a propensity to develop diseases or problems, infections in our head with colds and with all these flu shots that we're getting and all these things that we're putting into our body to protect us. Has anybody really given any thought to what the relationship is between doing all these injections and these flu shots and, I guess, what's this thing, the one that go around your shingles, the shingle shots and all this stuff? Yep. Are you're familiar with all that, aren't you?
I'm familiar with all that. I'm part of the minority opinion, but that's not unusual.
But
you know what I mean by the minority opinion.
Okay, I couldn't understand exactly what you did say then, Lane.
I have the minority opinion. In other words, I'm in the minority in what I believe in as compared to what the recommendations are by the Centers for Disease Control and most physicians. So in other words, I don't believe in any of those shots. I don't take any of them.
Okay, all right. Okay, well, everybody's got a right to their own opinion about the shots, and the irony of the thing is, so many people take the shots and then they get sick as heck, and some other people, it truly, truly helps. And I can think of one time that I took the shot and I developed a flu bug, and I was mildly sick. And I remember another time I didn't take the shot, and I thought I was going to lose myself through my socks.
Yeah.
So, I think it's an individual call. People have to make a decision of as to what they want to do. But what is not always good for the goose is not good for the gander.
No, it's true. And it is going to vary. I mean, just because I don't do it doesn't mean everybody should not do it. That isn't the idea. You've got to look at your own situation, whether you feel you're more prone to disease or not, and then you have to look at what the shot is going to do and know what the positives and negatives of the shot are before you make that decision. I'll tell you, the biggest difficulty I have is that this is a drug that's being sold. And so it's sold with the idea that it's good for you, you need to have it, when in fact we all know there's a profit motive behind everything that's being done. So you got to look beyond what the recommendations are and understand what the upside and the downside risks of all of those recommendations, because the recommendations may be good for some people and may not be good for others. And it's important you look at that.
Okay. All right, we got off track a little bit. And that was my fault. But let's go back to what we're talking about, the sinus. Let's say somebody comes into you with a problem, and as you examine them, you see some things that might lead you to suspect that one of the things that you're seeing is that they do have a sinus problem. Then
I can't tell you how many sinus problems I see in my office. I see them every week.
Okay, well, how do you go about deciding whether the sinus problem is a dental problem or not? How do you make a decision? How do you go about diagnosing between the two, cause and effect, chicken and egg relationship?
Well, for the most part, you can see on the CT scan whether the tooth is infected or not. And so if you see an infection around the tooth, and in that same area the sinus appears to be cloudy, then you can pretty much say that one is related to the other, or one causes the other, and then make the appropriate decision for the patient. It's pretty obvious. If you have a tooth that's infected, if it's been infected long enough, I mean infected for a few months, and a lot of patients have infected teeth without ever knowing it. They don't become painful. They don't swell. They're just infections that just sit there. They dissolve the bone, and when the infection dissolves the bone, you see that as a dark area around the end of the root on a X-ray or a CT scan. If above that dark area you see cloudiness in the sinus, then you can pretty much be assured that your sinusitis is coming from your tooth, or at least the tooth is at least partly related to it.
Well, can a dentist treat a sinus problem?
No, a dentist can treat a dental problem in order to be able to help alleviate a sinus problem. The dentist will not treat the sinus problem itself.
I guess my real question, what we're talking about today, is how does a person, say you got your teeth hurt, your jaw hurts in the hinge area, you got headaches, your shoulders hurt, and how do all those aches and pains relate to maybe some of the things that you as a periodontist would see in a person when they come in and sit in a chair, and you're going to notice a lot of these other things that are problems associated, say, periodontal disease with other body diseases or other body reactions and what they cause. I'm concerned because as I get older, I don't know how much I should be seeing a dentist. I don't know. My teeth feel all right. My gums feel all right. But, and I think a lot of people that feel that way may have a tendency to stay away from the dentist and not make the regular visits they should be make. Am I making sense here?
Yeah, but you've just asked me about 5 questions in that one sentence, so I don't know where to start.
Well, I'll tell you what. Since you're the dentist, and you know that what we're trying to do today is get our listeners to start thinking about whole body health and relationship of the mouth to whole body health, and not talking about filling a cavity or putting a tooth in. We're talking. Sometimes it's not just your teeth. That was an article you wrote for our newsletter. That was the title of it. Sometimes it's not just your teeth. So let's go back to the topic of that article. And, you talked about periodontal problems on the program for years. Yep. But how do periodontal problems relate to overall health? And then you can add that on top of the 5 or 6 other things, and that ought to let you talk for the next 4.5 minutes.
It'll be my monologue. This is great.
Well, we're going to get you. We're going to get you on the second part of the show too. So start talking.
Good. How much time do we have for the first part? It's 12:25 right now. I'll be a periodontist for a second, but we've discussed this a lot. We know there are certain bacteria that are associated with severe periodontal disease. And if you have those bacteria can have an effect on your heart, on your kidneys, on your liver, on your lungs, on your brain. And the more we look at this, the more we're seeing there's a causative relationship, that the bacteria in the mouth can cause problems in other parts of the body. It's important to be able to identify that bacteria, because frankly you can kill off that bacteria or control that bacteria in your mouth, which will help save your teeth and may save you from harm in other parts of your body as well. You're asking a question?
No.
Okay. So for us, it's spit in a cup so I can send your saliva sample out to a lab so I can find out what bacteria is growing there. And if I can find that out, I can be in a much better position to help you kill that bacteria and know what bacteria you're trying to kill. Because it isn't just deep cleanings, it's also antibiotics that we use in order to be able to help solve the problems of periodontal disease.
Well, I went to an eye doctor one time, and I had him on the show, Mike Mandizzi, and had him on a television show. And Mike explained to the audience the effect of the optic nerve as it went back all the way into the brain, and the effect of what was happening with the optic nerve and how that relates to the function of the eye. I guess a question, and then I go to the pain management people, and they talk about the effect of the pain in the joints that go back from the nerve centers in your brain, and when they try to manage the pain, what they're really trying to do is control the nerve centers that emanate from the brain that tell your body that pain is there. How does we got just a minute. We'll pick up more about this on the other side of the break, Lee. But do problems with the teeth work the same way? I guess the pain centers would, right?
It does if it's involving the nerves of the teeth. But if it's involving the periodontal portion of the tooth, which is the outside of the tooth, there are very rarely nerves that are stimulated. So therefore, we're not looking at a relationship between one nerve and another. We are looking at a relationship between bacteria around the tooth, around a diseased tooth, traveling to other parts of the body. So in one sense, and what Dr. Mandizzi is talking about, it's nerve-to-nerve relationship. Here it's bacteria-to-bloodstream relationship that we're looking at.
Okay, listen. We got to take a break, and And we're going to take a break right now, Lee, but let's back up on it. Remember exactly what we're talking about, because there's some more questions I want to ask you about this relationship with the teeth and pain. But stay with us, folks. I got some other things I want to talk about, especially jobs for seniors. So stay with us on the other side of the show. This is Joe Steckler, your host. Stay with us, and we'll have a lot more interesting. Take it away, John.
Our time coming up on 12:34 on this Wednesday afternoon here on 90.3 FM. It's Joe Steckler Day, helping seniors of Brevard. Let's get back to more of the show with your host, Joe Steckler.
Thank you, John. Was that something from the flight of the Bumblebee or Madam Butterfly?
Actually, that's Ramsey Lewis with the Sounds of Christmas. Jim and I were just talking about that. This album actually came out in 1961, and 61. It's a good Christmas album and some good cuts on there. But yeah, it's Ramsey Lewis.
Yeah, I know it's Christmas time. This goes with I don't advocate this, guys, but this year my wife put the Christmas tree up. I just simply could not do it, and I don't advocate you guys sitting back in the chair and letting your wife put the Christmas tree up by herself if you don't have to.
Unless you're sitting back with a glass of scotch or something.
Yes, exactly right. So there's some things you can get away with, and there's some things you can't get away with. But I'd like to just pick up on this. There's one thing before I get back with Dr. Sheldon. We get a lot of calls at the office at 473-7770, and Kim and when I was answering the phone, we get a lot of calls from seniors saying they need a job, and Walmart's always looking for greeters. They don't pay a lot, but sometimes seniors don't need a whole lot. They need something that'll keep them with food on the table and medicine in the medicine cabinet. But AARP has a back-to-work program, and they're going to have a free job club for seniors on Tuesday, December the 17th, starting at 10 a.m. at the Career Source Brevard, Palm Bay. And this is a chance for job seekers to network and discuss how to overcome challenges in a job search process. And it might help you with a resume. Sometimes you need a resume. There are jobs out there. You just have to know your own physical strength. Can you stand on your feet 8 hours a day? And you moreover, you've got to have a desire to want to help yourself. And if you have that a determination to help yourself, let me give you a phone number, and you can call the AARP Back to Work program and see if you want to go to some of their seminars and look how you might even think about going back into the workforce in a position that you want to go in. And believe me, there are some of these things, you might be amazed at some of these jobs where you spend 6 to 8 hours on a day calling on a telephone to market a product or something. You might think about, sometimes you meet some real nice, some weird, and some all kinds of people when you talk over a telephone, but it can be a lot of fun, and it might be a way to pass some time and put some extra money in your pocket. But that phone number it's area code 321-394-0638. 394-0638. You can always call Kim over at 473-7770. That's our office, and she can tell you about this. But, I see so many seniors that need just an extra $500 or $600 a month, and you don't have to kill yourself to earn that. You can do that fairly easily if you just make up your mind you want to look and see how you can do it. That's having the will and the desire to do it that's important. So with that, I get to get back to Lee. I really haven't let him have a lot of time today on the show, but you there, Dr. Sheldon?
Yep, I'm here.
Good. Okay. We're talking about periodontal diseases and health, and since since I have a heart problem, and it's under control, but I do have it, and I constantly think about the things I do that could cause me to hurt myself, but I think in my case, before I go to a dentist, they want me to self-medicate with a I forget the type of it's a capsule I have to take, but before they do a dental treatment on me, I have to take this because of my heart problem. Why do they do this kind of thing, Lee?
Well, if there are mechanical valve problems or mechanical valves, then the mechanical valves can pick up bacteria between the valve and the heart and the heart, the vessel itself, and so you can get accumulation of bacteria within the heart, and it can cause you to have an inflammation, which is pretty difficult to control. We used to prescribe antibiotics a lot more readily than we do now. We only prescribe antibiotics if there's a mechanical heart valve in place. All the other reasons that we used to have, which was a heart murmur or rheumatic fever or something like that, cardiac bypass, we don't prescribe antibiotics for that.
Well, if a person has a stent, if they have a stent and you have a periodontal disease, could there be a relationship between affect of a periodontal disease on the stent that's been placed over an artery?
No, there's been no data to show that.
It's not going to affect something like that, then?
No, it's got to be a valve. The stent is not a reason to pre-medicate.
Okay, what I was trying to get at is, what are some of the things that say, Joe's honest citizen that knows a little bit and has heard us talk on the show, and if they have some heart problems and they know whether they got their teeth are right or not, and they know whether they should be getting some dental work done, what are some of the more serious type things that people that have problems with their teeth should really be thinking about going and seeing a dentist for, Lee?
Well, I think if we're looking about relationship between disease in the mouth and disease in other parts of the body, it is periodontal disease that you're looking for. And periodontal disease is responsible for a great deal of tooth loss in the United States. So it isn't just for your teeth. It's for your body. I think the mistake that we sometimes make is being a little bit too slow to go to a periodontist to get that treated. That if the periodontal disease doesn't get under control in the general dentist's office, then you need to be referred to a periodontist to be able to take care of that and get rid of the problem. And so from time to time, I'll see patients who said, well, I had a deep cleaning at my general dentist's office, and it keeps on getting worse and worse and worse, and patients are referring themselves to me rather than the dentist referring to me, which is it's too bad. It shouldn't be that way. So if you're following your own periodontal health and you're asking your hygienist, how are my pockets doing, and your periodontal pockets are doing worse, then even if you're not referred by the general dentist to a periodontist, it's up to you to make an appointment with the periodontist yourself.
Okay. You've got a new laser, I think you have, in your office.
Yeah, very excited about it.
Okay. But how is the new laser therapy impacting care other than dental care? I've got a couple of thoughts on that I want to ask you about, but what would your comment be on that? Well,
I think there are a few areas where the laser can be very helpful. If you have a deep infection and you're having a tooth extracted, the laser can totally disinfect that extraction site, making healing go faster, much more complete. If you have a tooth that has a deep infection or you have a deep cavity, the laser can be used on the tooth itself to strengthen the dentin, to strengthen the underlying tooth structure in order to be able to reduce sensitivity after the filling, or even in some cases to prevent the need for a root canal, that the laser can be so specific in killing the bacteria and forming a dentinal bridge, which is a bridge of tooth structure over the nerve, that we can keep a lot of people out of root canal therapy, which I think is pretty neat.
Are you saying that maybe someday that we might be able to do a root canal with a laser?
Well, right now, root canals are being done with lasers. That, in fact, for some, if you place a laser or the right kind of laser into the canal itself, you still have to do the root canal procedure, but which means you have to open the inside of the tooth up and get to the nerve. But removal of the nerve is a bit of an imprecise game when we use those files and the different instruments that we use to clean out the residual nerve tissue. But the laser and the laser energy will kill off or remove the residual nerve tissue or blood vessels that we haven't been able to remove mechanically. So it essentially means that we can do a better root canal, or at least I think, do a better root canal with the laser assist than we do in conventional root canal therapy. It doesn't mean that a conventional root canal, if done by a good endodontist, isn't going to be good, but just like it's improving our extraction sites and helping to prevent dry sockets during extractions, at the same time it can help to prevent a residual root canal infection because we just weren't able to get our instruments into the right place in the root canal.
You know, Lee, I can understand why some of the changes in medicine, the use of lasers and all these other things, and I've heard so many good stories, and I've heard horror stories. I've heard stories about people that had laser surgery done on their back, their spine, and came out and they swore by it. It was a great treatment. But then on the other hand, I've had people that I've talked to myself that had this laser surgery on their spine, and they were going crazy trying to figure out how we're going to get what the surgeon did to them, get it undone, and they have to go in for for cut me open sessions and try to straighten up what a mess the laser made. So I guess what I'm asking is that would lasers if we really get into the place where we're using lasers and to do root canals and other things like that, and there's so much to understand, but is this something that you think that a general dentist would be doing someday? As remember years ago, the old general dentist did root canals and did all the stuff, right?
Yeah, it's true. I think it comes down to skill level of the person who's doing it. I think lasers are making it easier for general dentists to do root canals and be thorough about it. And the answer is yes. But we're still... I hate to look at the laser, although the lasers have done some marvelous things for our patients. I'd be happy to describe it. A patient, for example, who had trigeminal neuralgia, which is a very, very painful headache with sharp pains that were radiating throughout the head. I mean, really sharp pains, and we were able to see that in fact it wasn't necessarily just a neurological problem. That we found a tooth, extracted the tooth, cleaned out the extraction site. The pain got somewhat better, but then through the laser therapy. But then we used a different kind of laser wavelength on the nerve itself. And I'm talking about the facial nerve, and the pain has almost completely gone away. So you're taking a patient who's been on chronic medications and still, which were really debilitating her, and instead she's on no medications now, and she feels an occasional pain. It doesn't mean we've solved the problem entirely, but we've gotten it 90% better where she can now function and function normally. that's pretty exciting. I mean, this is something where there were very few answers, and this did provide the answer. In terms of lasers, the way they are now versus where they were 20 or 25 years ago, computer programs have very much entered into laser therapy. And so through the experience of others, we know that for a particular procedure, a certain wavelength will work. And so if we push the button in order to be able to control that particular problem, we're doing that based on the experience of others. The fact that we have a broader base of experience gives us a better chance of having the laser therapy. And I can't comment on the back, that's not my area. But it gives us a better chance of controlling the problem within the mouth. Very exciting. It took me up till now to be able to say it's worthwhile getting a laser because I wasn't impressed with the results that people were getting. But now, with the technology having developed as much as it has, then what laser therapy was 10 years ago and what laser therapy is now could be two different types of lasers, totally different types of experiences, and two different levels of success.
Yeah. Well, go back. You over the last 15 years, you have gone out of the way to look into new treatments that you can bring into your own dental practice. And you've gone to lectures and stuff. You've gone out of the country. You've participated in different things, and I don't think your learning curve has ever stopped. I'm not certain that everybody does the same thing, and I've asked you some hard questions over the years that you and I have done radio and television shows, and some of them have not always been fair that I've asked you because I put you across the breakers in answering some of those questions. But as you get older and you see problems and you see things that you think shouldn't happen, and it's a terrible thing, Lee, to see a patient afraid to tell her doctor or his doctor that something was wrong or did you do this right? And there are so many doctors and dentists that would take that question the wrong way, and that person's got to sit there and think about what that doctor or dentist is going to do to him over the next 4 or 5 minutes or 15 minutes, and it can be a frightening thing. But at the same time, I know in your own practice that if you're concerned about what a person might experience as a result of what you have done, you have given them your personal cell phone number and told them if they had a problem to call you, no matter what time of the day it was.
Sure.
No, and I know one other dentist that did the same thing to me. And when we get into this business of straight dental costs, dental discount programs, dental insurance program, and since I've had to, talk to seniors and everything else, I've had to look into all this stuff. And I'm beginning to see that there's just a heck of a lot I don't understand about it, and but I get into the general area of crowns are something that you start to think about a dental implant. You put an implant in. If you have a problem with the crown, it's not going to hurt when they fix that. When they go in to repair the crown, because there's no more connection to the pain center. But that's not always the case with how people receive treatment, and that's always been a concern of mine, and it's been something that it's hard to talk about that on a radio show with a dentist or a doctor that I know is honest and it cares very much about what their patient might experience. So what I'm saying is, what is your thought about what I'm thinking?
Well, my thought is this. We are a service profession. And unfortunately, we're being sold, and we're creating the idea that we are a product profession. Okay, so product means a crown, a filling, an implant. And we start to get costs involved in providing that product, and we make the assumption that everyone who is providing that product is providing it in exactly the same way. And the truth of the matter is, it isn't. That we're still looking at the service provider, the person who's providing the services, as being trained, talented, ethical. And you've got to look at that as much, if not more, than this product has been recommended to me. I'm also totally disturbed about the fact that there is commission sales that are going on in dental practices. And, there's nothing wrong with commission selling. I mean, that is the backbone of sales. But you've got to match integrity with that kind of a bonus system, particularly when it's a non-dentist who's making the recommendations. But even when it's a dentist's recommendation. So we've got to look at ethics and training as being first, and the product has to be second.
Well, I think it's easier to tell a general practitioner, a doctor, that you don't agree, or can we do something differently? It's easier to talk to that kind of a doctor than it is to a dentist, because you're sitting there with your mouth open and you don't know what that dentist is seeing. And it's just like, and there are good doctors, and there are doctors that are not quite so good, and there are really good dentists, and there are dentists that are not quite so good. And if you get the really good ones, you don't have to worry. But if you leave a dental chair and you're not happy with your treatment, what the heck are you supposed to do?
Yeah, it's difficult, Joe. It's not easy at all. We think we're pretty good, but not everybody in Brevard County can come to see us, and nor is it even necessary. I mean, we're a very busy practice, but that isn't the idea. But the idea that a patient can't understand what's going on means that we're not doing a good enough job of explaining it to the patient. Because in our office, we feel that our patients can make the correct decision because they can see it and it makes sense. And just whether it's in medicine or plumbing or dentistry or any place, it's got to make sense to you for you to be able to make that decision. And it can. There's nothing that complicated in any part of the body that we can't sit down and explain it correctly, so that you can make the correct decision for yourself.
Lee, my wife was driving a car the other day down Wickham Road, and I looked at all these new places going up, and I kept seeing dental practice after dental practice after dental practice, and I was thinking the very same thing that you were just talking about. And I wondered, how many of these people cared enough or took enough time to explain to the person that they're going to work on what the heck they were really going to do to them? I know you did this because you explained to me. Now, maybe you were afraid of me, but I don't think you were afraid of me. But you explained to me explicitly what you were going to do, and I had questions, not a whole lot, because you explained it to me. And I bet you that if 30%, if even that much, of the people that go in for dentistry work have a dentist really explain to them why they're doing what they want to do, or explain the whole treatment plan. And I think that's correct. I think with anything, you look at the 80-20 rule. The 80-20 rule, I think, is a really, really, really good rule here. Okay.
And so, you've got to look at, in any of these professions, you will have to look for the 20. You have to look for the top 20.
Okay, Lee, we're out of time, and I just want to thank you. And I just, since I won't get you back on the show before the Christmas season here, I just want to wish you a happy Hanukkah. And
thank you, and Merry Christmas to you too, Joe.
Yeah, I know you say Christmas and you say Happy Hanukkah and everything else, and I'm not sure what else you might say, but
I don't know what that means.
I got you laughing. Okay, but it's always a pleasure, Lee, to have you on the show, and
I love it.
best to Elmer, and I got things I wanted to talk about, and I didn't do it, but I'll start the show off next week, talk about August Felton, who is a financial guy. See you next week, folks. Bye-bye.